Hello everyone, welcome to sqadia.com, and now we will go over the last section of our lecture, Axial Skeleton, in which we will talk about the abnormalities of the axial skeleton. There are different abnormalities of the axial skeleton, but we will talk about some very common abnormalities of the axial skeleton, which is stenosis of the lumbar spine. As the name shows, stenosis of lumbar spine, it can happen in any other area, but we will try to just talk about the lumbar spine because it's very common in the lumbar region. Then the other is the cleft palate and scoliosis, kyphosis, and lordosis. So first, the stenosis of the lumbar spine. Stenosis. What does stenosis mean? It's the narrowing or compression. Stenosis of lumbar spine. As you see in this diagram here, when the narrowing or compression of the lumbar spine takes place, the spinal cord, which is passing through this in the spinal canal or cavity, there is pressure on that spinal cord. And due to this pressure on the spinal cord, there is numbness, there is pain, lot of pain, tingling and muscle weakness. So the patient usually complain about the very bad pain in the lower back, and they can tell the doctor that we don't feel anything and this area is numb and the muscle are weak. So these are the symptoms of the stenosis of lumbar spine. It can be due to the osteoarthritis. It can be due to osteoporosis that occur with the old age, and it can be due to wear and tear of the bone. Wear and tear can cause the loss of the muscle mass of the bone, and due to loss of the muscle mass, they become weak and they are compressed. And when they compress the spinal cord that's passing through them. The treatment for this can be different, postural relaxations, some, medicines to relieve the pain. But the most important therapy or the treatment is the surgery to relieve that pressure that's on the spinal cord and the nerves. Maybe most commonly surgery is not very 100% curable, but it can relieve that severe pain that the patient is feeling. So stenosis of the lumbar spine. Next condition is the cleft palate. Cleft palate is due to poorly developed palate during early development. In the first few months, in the first 2 to 3 months when the fetus is developing, cleft palate occurs when the palate is the roof of your mouth. Roof of the mouth is the palate. If you touch the top of the mouth with your tongue, you can feel the back of the roof is soft. That's called the soft palate. This is soft. The front is the hard. That's called the hard palate. So palate is the roof of the mouth. Back is the soft palate and the front is the hard palate. This cleft palate usually occurs in the soft palate. And due to failure of the fusion, there is a hole left in the soft palate. And due to this hole, usually the diagnosis is not very easy in the early childhood when the newborn baby is born and they cannot open their mouth fully when this problem or this abnormality is on the back. Usually it's ignored in the beginning, but slowly when the complications occur and then they found out that the child is born with the cleft palate. What are some complications that can occur is middle ear infections are very common due to this opening. Bacteria and the germs can very easily reach to the ear. Then there are also speech problems. Difficulty in swallowing is also another problem. When the baby swallows milk, the milk comes out from the nose instead. So this is another problem or complication. Speech problems. The baby, as the speech develops, there is nasal twang or nasal resonance to the speech. This cleft palate also cause hearing loss due to pressure on the eustachian tube. This eustachian tube is responsible for maintaining the pressure in the ear. So when there is problem with this eustachian tube, it can cause hearing loss. So the cleft palate, the treatment for this cleft palate is the only reconstructive surgery that can be performed in the first year of the life. So the too many complications can be avoided. Next are the deformities of the spinal curve. As we talked before about when we were talking about the vertebral column, that the vertical column gives the straight alignment to the body. So anything that deviates from that normal straight alignment can be a problem. So these are the three very commonly used terms for the abnormalities of the curve of the spine. First, we have the scoliosis. Then we have kyphosis and the lordosis. This kyphosis is posterior curve of the thoracic spine. If you see, this curve is on the top thoracic region. So it's the posterior curve deviation from the normal. They are showing you the normal spine. So deviation from the normal going posteriorly, and this kyphosis is the posterior curve of the thoracic spine, and this is also known as the hunchback or humpback. It's drooping of the upper part of the body takes place. Kyphosis can lead to different breathing problems and things like that. Then we have the scoliosis. Scoliosis, if you see, this is the normal spine. This is the lateral curve. This is going laterally. Median, this is the middle part, and anything that goes away from the middle part is the lateral. So this is the lateral, the spinal cord or vertebral column is moving laterally. And then in lordosis, we have the anterior curve of the lumbar spine. This is the lumbar region, so it's the inside curve of the lumbar spine. So whenever this vertebral column deviates from its normal position, different problems can occur. The most important is the problem with the posture, shape, because it gives the alignment to the body. Posture is not normal, then it can cause breathing problems, and different compression problems can also occur. Any deformities of the spinal curve or vertebral column, usually the pediatricians check it when they tell the child to bend over and they touch their hands to the feet and they just follow on the back to see if it's straight or if it's deviating to the side. So it's important to find out the curve of the vertebral column. So this concludes our section 5 of the lecture Axial Skeleton, in which we talked about some common abnormalities of this axial skeleton, which are the stenosis of the lumbar spine. Then we have cleft palate, scoliosis, kyphosis, and lordosis, which are the abnormalities of the curve of the spine. Thank you for watching sqadia.com.